Hey, everybody. I want to welcome everybody. We're in Coleman, Alabama for everybody that's online, and we're here to do our third annual MS Symposium here at Coleman. All right, my name is Stuart Schlossman. I'm president and founder of MS Views and News. I too have MS. You all know the story already. Today's program, I would like to thank Sandoz and Novartis for sponsoring us to do this event today, and I hope that you all can give them a round of applause and say thank you as well. All right, our presenter is Karen Hislop, who's a occupational therapist from the Huntsville area, and she's been doing this for a number of years. In fact, I think she said that her first treatment was around 2009 when she started. And she also runs a very productive MS support group up there, I think called the MS Rockets. Is that what it is? Rocket City MS. All right, so let's welcome Karen and we'll get started.
Thank you very much. I, as Stuart said, I'm an occupational therapist. I've worked with MS for a long, long time. In 2009, I worked at HealthSouth for a long time. And then after HealthSouth reorganized, I started Therapy Achievements in 2009 because I really felt like the multidisciplinary approach, OT, PT, and speech, made a huge difference. More than just PT alone. So that was kind of my motivation for starting Therapy Achievements. And my involvement with people with MS has been probably back since 2008. When I worked at HealthSouth, I worked with MS patients. And then when I started Therapy Achievements, I realized that people with MS have great days, bad days, and it's really hard for people with MS to host a support group on a regular basis. So I thought, well, gee, I don't have MS. I'm going to be pretty good every day. I'll host the support group, and then people can come and go as they're able to. So that was in 2012 that I started the Rocket City MS support group. And people come and go over the years as they need support and as they don't. And so it's worked out really, really well. But today, what I want to be talking about is living with MS, strategies for improving your independence. One of the biggest challenges people with MS has is figuring out what their problem is. A lot of times their symptoms are variable and unexpected. No two people have the same symptoms. Each person's symptoms can vary or change. And so this can make getting a diagnosis very difficult. Just deciding that you have a problem can be delayed by, you can think, gee, I'm too young for anything like this to be happening. It'll go away. Waiting to see if it goes away, thinking you're too young. Then when you finally decide, all right, this isn't going away, I really probably should do something about this, figure out what's going on. Then you have to go through the whole process of ruling out everything else it could be. And so that makes getting your diagnosis delayed sometimes. And delays in getting a diagnosis can make your life harder than it has to be. Once you get your diagnosis, not knowing what to do with that, okay, I have MS, what do I do with that, can also help make a delay in figuring out what to do and how to get your symptoms treated. So the first step when you get diagnosed with MS that I'd advocate is get your MS team together. So your team includes your neurologist, your primary care therapist, or your primary care physician provider, your therapist, that includes physical therapist, occupational therapist, speech therapist, personal trainer, social worker, psychologist, and your nutritionist. That makes up your healthcare team. Your primary care team is your family, your support group, and then your healthcare team, and then your healthcare team includes these folks. So how about your therapy team? So we've got your primary team, your healthcare team, and then your therapy team. Physical, occupational, and speech therapy. But what's the difference? Who does what? Do I need physical therapy? Do I need occupational therapy? So hopefully this talk is going to help you figure out who can help you with what. So here are the top 10 symptoms of MS and what your therapy team can do to help make your life easier. So the first top symptom of MS is fatigue. Fatigue occurs in 80% of people with MS. It can significantly interfere with your ability to function. It's very different than just being tired after you've overdone it. A lot of times you feel like people just don't get it. This isn't just I'm tired. I'm like, this goes down to my bones. And so occupational therapy can help with training in pacing and energy techniques and identifying adaptive equipment to help you save your energy. So the spoons analogy is, if you think of your day, if you get up in your day and you evaluate how much energy do I have today? Is today a good day? Is today not such a good day? So if today's a good day, you might have 10 spoons of energy. If today's not such a good day, you might have 5 spoons of energy. So first of all, decide how many spoons you have, and then decide how you want to spend your spoons. So if you wake up and you're having a great day and you feel like I've got 10 spoons, you might want to take a shower, you might want to go for a walk. But if you wake up and it's a bad day and you only have 5 spoons, you might want to skip the shower today because that's going to take up some of your energy, and decide I'd rather spend my time making sure that I could cook dinner for my kids when they get home instead of taking a shower. So that's, in a nutshell, the spoons analogy. And then tips for pacing. So, and I apologize for the bunch of stuff on this slide. I tried to make it better, but anyway. Pacing techniques, again, you want to be aware of what your energy level is and establish your baseline. So know what your normal day is, know what a good day feels like, what are clues that you are going to have a bad day, so that you can plan accordingly. And then make sure that you schedule rest and relaxation in your day. So if you know you're going to take a shower and then you're going to have to cook dinner tonight, make sure that you get a rest or a nap in between. If you know you've got a doctor's appointment today, for example, if you need to go see Dr. Legank, let's say you live in Huntsville, you know that's a 2-hour drive. You know I'm going to be in the office for a while, then I got a 2-hour drive home again. So you might want to schedule your week to tomorrow after my appointment, I am doing nothing. I am just going to rest all day tomorrow because I know today's going to tap my energy out. Then you also want to save and budget your activities or your energy. Improve your sleep. So if you have issues with sleeping, if you have anxiety that interferes with your sleep, if you have sleep apnea, get those conditions fixed. Do all that you can to make sure that you're sleeping well at night, because that's going to make a big impact on your energy level. Live within your balance. So my Aunt Marilyn, I love my Aunt Marilyn. She's 92, and all of her life she has had FOMO, fear of missing out. If you say that you're going to do something, she immediately says, oh, I want to do it too, despite the fact that she's 92, has an autoimmune disorder, her joints are a mess. She just can't say no. So she oftentimes way overdoes it. So be aware of that. If you are that personality where you just know that you're going to want to do it, if somebody invites you to something, plan ahead. So say, okay, when somebody invites you to something, hedge it with, I'd love to do it. Might not be able to do it that day, but I'll let you know at the last minute. In your mind, practice saying no. Practice saying, I don't feel so good today. I'm going to tell them no, I'm not going to go because I need to save my energy. So speaking to the choir, the apple doesn't fall far from the tree. I totally can relate to my aunt's FOMO tendencies. So I have to practice before I commit to something, how I would back out of that and say no if I needed to. Okay, then you want to use good ergonomic techniques. Your largest muscles are your strongest muscles. So if you're carrying something, instead of carrying it in your hand, think about carrying it on your elbow, or even better, think about carrying it on your shoulder. If you've got to push something, your legs are bigger, stronger muscles than your arms. Think about pushing it with your foot instead of pushing it with your arms. Make sure your postural alignment is correct so that you're not using more energy than you need to when you're moving things. And then also, again, build in ways to recognize when you need to stop and take a break, and try not to get involved in activities that you can't stop. So if I'll use cooking a meal. If you are going to cook a meal, try not to cook something that requires, stirring for 20 minutes, or it's not going to work out right. Take a step back and do something simpler that if you get tired, you can stop and rest, and it's not going to ruin your meal if you take a break in the middle of cooking it. Adaptive equipment for fatigue. So save yourself some energy in every little way that you can. Details matter. So wear Velcro shoes, use shoe horns, use reachers, use adaptive equipment for dressing to make it easier. Use adaptive equipment for transfers. Use bed rails, use a transfer pole. Think about transfers that you have to do and what you can do to make it safer and easier. In the bathroom, use toilet rails, use high-rise toilet seats, use grab bars. Think about making transfers easier in the bathroom. Think about where you put stuff. So put stuff that you use frequently in an easy-to-reach area. Put soaps and shampoos at a level area so you're not having to reach overhead. Some people have problems with dizziness, so you don't have to tip your head back in order to reach things. Use tub bench, use tub seat. And then in the kitchen, think about using rolling carts so that you're not having to go back and forth from the kitchen to the table. Pile it all on a cart and make one trip to the table. Again, arrange your kitchen so that the frequently used things are in easy reach and you're not having to reach overhead or bend way down low to get the things that you use very often. And then furniture. Think about making the height of your furniture correct for you to be able to get up and down. If it's too low, think about putting it on risers. You can buy those at Bed Bath & Beyond. You can buy them on Amazon. They're pretty easy to get, and they can really be helpful. Okay, and then use armrests on chairs to help push up. Use nose over your toes. Make sure you're using the proper body mechanics when you're getting up. If it takes like 20 times more energy to stand up if you're not getting your nose over your toes to get your center of gravity where it needs to be. Problem number 2, gait and balance. Difficulty with balance and walking result from weakness, spasticity, and loss of sensation when you've got MS. And so physical therapy can help with balance and strength training and with mobility aids. So one of our favorite balance training tools is the Bioness Bits. It's got a little platform that you stand on, and you can practice keeping your balance while you're moving your center of gravity. You can practice keeping your balance while you're doing visual tracking and dual tasking. Mobility aids for weakness, AFOs or foot orthosis have gotten much lighter in weight. They're much smaller profile than they used to be, and that can help with foot drop if you have a tendency for your toes to not be able to pick up when you're walking. The hip flexion assistance device is new. The robotic stuff is still a little bit out of price point for most people, but it's coming down and it's getting to a point where it's affordable for people. But outside of the robotic ones, there's also other supports that are affordable and are very helpful for hip flexion assist. And then mobility assistance, we've got the Biodex sit to stand assist. It's got a harness that you put on, and it can help you with sit to stand. And then it also can off weight you so that as you're walking forward, you don't have your full body weight. And if you've got weakness, it doesn't take as much strength to advance your foot. And then as you get stronger, you can put more and more of your body weight on your legs when you're walking. Mobility aids for transportation, the ultralight walkers, the ultralight transport chair, foldable electric chairs. Those are all things that are available that, again, are lighter in weight. They're sportier looking than they used to be. And another slide that I accidentally omitted was wearable technology. So wearable technology are things like the Sionic NeuroSleeve, and it's a Velcro wrap that you put on your leg that has eStim on it that will help to trigger your muscles when you're walking. There's the BioNess for foot drop. It is a little cuff that you wear on your leg, and it provides eStim that helps to lift your toe up for when you're walking. And then the coolest, latest thing for our stroke and brain injury patients is the IPSY hand. It's got this headpiece that can detect brain activity. It translates that activity to a handpiece. And so for people who can't move their hand or who can't move it well, it is so cool. They can use their thoughts to open and close their hand. And so we've had patients who haven't been able to use their hand in years who, with this device, by thinking about opening and closing their hand, can open and close their hand. So really cool. Functionally, it's not at the point where it enables them to functionally use their hand, but it taps into neuroplasticity, where it's connecting that pathway of the brain activity to the motor response. And by exercising that pathway, we can grow it bigger and make it stronger, and they can start to gain some movement that they haven't had in a long time. Symptom number 3, spasticity and numbness. So between 40 and 80% of people with MS have spasticity and numbness. And physical therapy uses modalities to help with that. And Dr. Heyman just was talking about shock therapy that uses sound waves, and then the light therapy uses light waves, and both therapies stimulate the cells to start to repair tissues and decrease spasticity. It stimulates the mitochondria, the fibroblasts, and the other cells to help reduce inflammation and promote healing. So the sound waves penetrate deeper into the tissues than the light does. The light penetrates only just past the skin level, whereas the sound waves penetrate all the way down to the bones. And then eStim is another modality where we put electrodes on your skin, and it provides a little current to contract your muscle, and that can be very effective in controlling spasticity. And recently, dry needling with eStim is a modality that our clinic finds really effective. Dry needling uses acupuncture type needles that you put down into the muscle belly. The difference between dry needling and acupuncture goes through the skin. The dry needling needles go down further into the muscle. So if you've got that needle in the muscle and then you do eStim, that can really be effective with managing spasticity and pain and breaking up fibrosis. Okay, symptom number 4 is weakness. Weakness can result from deconditioning of unused muscles, and physical therapy can help with helping you figure out what exercise program is going to work best for you. So different types of exercise include aerobic exercise, and that's exercise that gets your heart rate up. And it's recommended that you do 2.5 hours of aerobic exercise per week. Stretching is really important if you have MS, and especially if you have spasticity. It helps maintain your range of motion. By having flexible muscles, it helps to decrease your pain. So yoga, Pilates, Tai Chi are great stretching exercises. In Huntsville, we've got a new group called Stretch Lab. They'll come and stretch you, and I haven't tried it myself yet, but I want to. People have said it feels really, really good. And so you want to make sure that you stretch for at least 10 minutes a day. And then resistive exercise helps build your strength. And so that's any exercise with resistance, weights, bands, and you want to make sure you hit all of your muscle groups when you're doing resistive exercise. And resistive exercise, ideally, you want to do twice a week. The key to exercise is something is better than nothing. So we talk about, ideally you do it twice a week, ideally you do it every day, but then life happens and you don't do it twice a week and you don't do it every day, and you think, oh darn, it's just not working. Don't give up. Something's better than nothing. If you haven't done it for a long time, 2 reps is better than no reps. So something is better than nothing. Okay, symptom number 5 is vision problems. So many people with MS end up with optic neuritis, and we have a group here that represents a product to help with that. Treatment for optic neuritis is IV steroids typically, and for most people that improves their vision problems. However, unfortunately, for a number of people, the steroids don't work, and they end up with some permanent vision loss. So in that situation, occupational therapy can help with strategies for low vision. If you've lost your vision and are not able to see, they can provide strategies for lighting, for contrast, and for magnification. So examples of contrast are making sure that your light position is correct so that you don't have shadows, making sure you've got night lights on, illuminating areas where there's steps or stairs, and looking at contrast, color contrast. Patterns on floors. Has anybody been to a hotel and the pattern on the carpet is just like, whoa, like I don't even have vision problems and balance problems, and sometimes the carpet in some of these hotels is just like, whoa. So that can really make balance a challenge. So think about that. Enhancing edges of steps, like these steps here. If there's the same color, if you had a visual problem, it would be really hard to tell where the step is. But if you put on the edge a different color, that would really help you to know where the edge of the step was. And using handrails. Dizziness and vertigo. Many people with MS end up with dizziness and vertigo, and physical therapy can help. They treat BPPV, which is benign proximal positional vertigo. That's not caused by MS, but people with MS can have more than one thing happening, right? So just because you have MS doesn't mean that's the only thing you have. You can also have BPPV. You can also have arthritis. You can also have pain from other reasons. And so physical therapy can help treat that. And so the treatment for BPPV is a maneuver where they move your head a certain way to try to correct what's causing the dizziness. They also work on exercises that involve turning your head in various directions to help reduce your dizziness and vertigo. And symptom number 7 is cognitive changes. So 50% of people with MS end up with changes to their cognition. It's almost like my cancer patients. It's almost like a chemo brain. But for MS, they call it brain fog. It feels like you're just not sharp like you used to be. You can't remember stuff like you used to be. You can't think as fast as you used to. And so speech therapy can help with cognitive changes. So speech therapy can help restore your memory, give you strategies for organization, and strategies for memory tips. So some memory strategies would be key idea. If you're listening to somebody and you're thinking, oh, how am I going to remember this? Zoom in on the key idea and hang on to that. Linking things together is a strategy for remembering. Chunking things, like if you're making your grocery list and you're trying to remember, okay, I need dairy, I need 3 things in the dairy department, I need 2 things in the fruit and vegetable department. So chunking things, making lists. For me personally, I like to make lists, and then I like to add a motor component to it. So because the more sensory input you have, the more likely you are to remember it. So if I don't have a pencil and paper to write my list down, I'll think in my head, I need bread, milk, apples, and I'll intentionally, forcefully put my fingers out, because then that motor and sensory input helps that list to stick in my head better. Rehearsing things, repeating it over and over, paraphrasing things, visualizing things, and drawing things are all strategies that can help you with your memory, and speech therapy can help you identify which of those strategies is going to work best for you. Not every strategy works for everybody. They also can help you identify apps and organizers and timers and different types of gadgets out there to help with your memory, with your processing, and being able to function in your day. And let me back up. One of the things that I really like is on organizing, and it fits with conserving your energy too, are time blocks on your calendar. So this worked particularly well with some of my patients. We have a magnetic calendar, and we have magnets of that are little squares, and each square is a different size, and it relates to how much energy it takes to do that. So if you have a doctor's appointment, that square might be that big, versus if you have to, eat cereal for breakfast, it might be that big. And so you plan your day by putting these blocks on your schedule, and it gives you a visual representation of how much energy it's going to take. And it also gives you a visual representation that you've got too many activities, like your schedule, your column for today is full. You've got too much stuff on that. You got to take something off, because it won't fit in the column. It gives you visual representation of how much energy it takes and how much energy you have available to do that. Also, make sure you can get rest breaks scheduled in there. Okay, so speech problems are another issue that affect about 25 to 40% of people with MS. And speech problems can include slurring. The coordination of your mouth muscles isn't great. Loss of volume. You end up speaking very softly, and it's hard for people to hear you, and stuttering. So speech therapy can help with articulation and voicing exercises. One of our personal favorite exercise program is the LSVT Loud program, and it was originally designed for people with Parkinson's disease, but it works great for people with other neurological problems too. And it's a systematic way to train you to speak louder and articulate more clearly. And then problem number 9 is swallowing problems. Because you have weakness with your mouth and swallowing muscles, many people with MS have problems with swallowing called dysphagia. And so speech therapy can help with that. If you find that you cough or choke easily, that's a clue that you might have problems with swallowing. And it starts off with an evaluation, trying to figure out what's going on. And a flexible endoscopic evaluation is one way that we look at swallowing problems, and that's where they put a camera down your throat, and as you eat and swallow, the camera is looking at what's happening in your throat, so we can see exactly what's happening. And then from there, we can prescribe specific exercises to do. One of our favorite things for people with swallowing problems is Synchrony. It's a biofeedback system where they put electrodes on your throat and it detects how much muscle activity is happening with your swallowing muscles. And so you can get a little bar graph to show if you have problems with swallowing. I have to say, swallowing exercises, hands down, have to be the most boring, hardest to do exercises out there. Just try it yourself. Try swallowing 10 times right in a row, and you'll see that that would be really hard to do every day. And then it's discouraging because you can't really tell if you're getting better. You know, it's like, I think I'm getting better. I'm not sure I'm getting better. And if you can't tell if you're getting better, doing something that's really hard and boring is like not going to happen. So the great thing about Synchrony is you can see progress. You can see that actually this effort I'm putting into it is helping. You can see how much progress you're making. And then they also have little games that you can play because that's way easier to do than just straight out exercise. So they got like a little kangaroo, and when you swallow, the kangaroo jumps up, and if you swallow really hard, the harder you swallow, the higher he jumps, and he's trying to jump to the tree to get some fruit. So it's really a really neat treatment tool for dysphagia. And then symptom number 10 is depression. Clinical depression is the severest form of depression, and it's the most common symptom of MS. In fact, for many people, it's the symptom that they first get that gives them a clue that they have MS. And so MS is linked to, depression is linked to MS so strongly that it's really important to get depression treated. It can make a big difference. And hand in hand with getting your depression treated is making sure that you connect with other people, being part of a support group, other people who can understand what you're going through. It still amazes me after all these years. You know, I'll see people in therapy and I'll think, oh, you know, we did great, we helped them, you know, and then they'll come to a support group and they'll talk to other people, and I realize, you know, the difference that makes. Talking to your therapist is completely different than talking to somebody else with MS who really gets it. And so support groups are a really great part of treatment. And like I said when I started, committing to a support group doesn't necessarily need to be a lifelong thing. You know, if you need help, come and go as you need it. Some people make lifelong friends. We have people in our support group who have been coming since we started in 2012. Other people come when they're in a crisis, and then they're okay, and then they come back if they have another issue that they need to deal with. So there's no one right way to attend a support group. There's no pressure to keep coming if you don't need it anymore. But when you need it, make sure you reach out and connect to a support group. So we've got our support group in Huntsville, meets on the third Tuesdays of the month, and I've got little business cards on that table. Pick up a card and stick it in your pocket. Give me your email and I can put you on the reminder list, and then you'll know when our meetings are and what the topic we're going to be talking about is, and then you can come if you want, and no pressure. Don't have to come if you're not interested. Okay, so the takeaway point is keep active. Keeping active is one of the most important factors to living well with MS. And being mindful of the factors that put you at risk for fatigue and depression, taking preventative actions is very empowering. When you have a disease that you can't control, being able to control any piece of it can be very, very empowering. And it will keep you independent as long as possible. Any questions?
Everybody say thank you. That was an awesome dialogue, and I want to thank you. And it reminded me, though, of something that even affects me. We're talking about cognition here. Why is it that if I tell or I ask somebody to remind me of something, or if once I write it down, that it could be days later and I still remember what it was that I needed somebody to remind me of? Why does that happen?
So memory is affected by a lot of things. If you're anxious about it, If you're really worried that you're going to forget about it, that can make it stick in your head more. If you are really focused on it, how much attention you pay to something affects if it sticks in your mind or not. You will forget things if you are anxious. If you're anxious about something else, if you're under a lot of stress, you are not likely to remember things that you're trying to remember. And like I said, sometimes if you can attach motoric or sensory things to it, like I said, I use the trick of trying to put my fingers out to remember things because I'm connecting a motoric action to the thing I'm trying to remember.
Where do people find resources for each of the different conditions that you even just spoke about?
So my go-to is Google, Dr. Google, right? So if you have a specific condition, if your spasticity is an issue that's a problem for you, I Google spasticity treatment near me, and then you'll come up with a whole list. Then you have to discern, okay, from this list, who could really help me? And so sometimes calling around, checking out, asking your healthcare providers, if your healthcare team say, I've got spasticity, I'm not sure what to do, call your therapist, call your doctor, and then support groups. Most everybody in the support group has had what you've had, and they've tried all kinds of things. And so they're probably your best go-to. I tried that, but it didn't help me. Keep in mind, everybody's different. What didn't work for one person might work for somebody else. Just because it didn't work for your friend doesn't mean it won't work for you. But your support group buddies can be a really great source for treatment.
Great, thank you. Also on our website, we have an accessibilities page. So if people need to go on there and find different sources of where to go to for that are more accessible for you, then you can visit our website. And another question for you, I have a couple of them coming up, is that I forgot what the question was. Oh, about skin sensitivity. What do people do with skin sensitivity?
So there are treatment techniques for that. E-stim oftentimes can help with skin sensitivity. Sometimes a version, it's desensitization. It's starting with stimulation that you can tolerate and then gradually ramping up the amount of stimulation can help with skin sensitivity. And then avoidance techniques, being aware of these are certain textures that bother me. I can take this kind of texture, but I can't take that kind of texture, and just avoiding the ones that are going to be a problem for you.
Okay, thanks. Did you speak anything about what people could use in their homes for like robotic type therapy or assistance rather, in the kitchen, or whether they needed to get from their bedroom to their bathroom?
So there's a whole bunch of new products coming out on the market. That's one of the things that's super exciting to me is the availability of technology. It used to be that these things were really expensive and only research centers could have access to some of the stuff. That it's all coming down in price and available to consumers is really exciting to me. And so there's a whole array of walking devices. There's BioNest, there's the NeuroSleeve, there's WalkAid, and because there's such an array of things out there, I really recommend you team with your therapist to figure out what's going to work best for you. I have seen patients spend a ton of money on stuff that doesn't work for them. And so I would really recommend teaming with your therapist. A lot of times they can get the device and you can try it before you buy it, whereas at home, you as an individual might not be able to do that. And that's always our preference, is to try it in therapy first, make sure it's going to work. And then if it's going to work, then we'll go on and pursue getting it for you.
Thank you. You just mentioned a few things that I'm sure the audience has no idea what you were talking about. You said a NeuroSleeve. Explain. Psionic. Talk about the BioNest device. Can you explain that to them a little bit further as well?
Yep. So those were That was one of my slides. So BioNess is a device that is a cuff that goes around your leg, and there's a thigh piece, and it provides electrical stimulation to contract your muscles. The NeuroSleeve is a similar device, but instead of a cuff, it's in a wrap, a Velcro wrap. BioNess has been around for a while. It has excellent timing with detecting when your heel strike's going to happen and triggering an E-stim to lift your toes so that you can have a pretty normal gait pattern if you've got foot drop. NeuroSleeve is new. It's brand new, and it's incorporated AI in its mechanism, and so that's a great option for some people. And what else? We talked about the IPSY hand, that detects brain activity. Yes, ma'am.
I'm curious what strategies other people use to remember things.
Strategies for
Remembering things. I make a list, an alphabetical list. I'll remember something starts with a P and an R and an S. And then I will walk into the room and say PRS. And I will think about what those things are. I'm curious what other kind of strategies people use. You said you count the number of things you have to remember. What do other people
count
do?
With motor thing. What works for you? So I am horrible at acronyms, so PRS wouldn't help me very much, but the counting does. And so other strategies are clumping things together. If I have a long list, I might remember one clump, and then I have another clump that I remember. There are apps that are very helpful. There's a bunch of different list apps. Does anybody use a list app out there? Yeah. And so that is a lifesaver for a lot of people. You can do the old-fashioned technique of my grandfather never went anywhere without he had this little tiny notepad that was stick in his pocket. He never went anywhere without his little notepad, and he'd write things down. And then timers, so you can set your smartphone to go off, a timer to remind you. I do that if I get involved in a task and I know I have an appointment at 10 o'clock. I set my timer to ring at 9:50 to remind me to stop my task and make sure I get to my appointment on time.
I have so many reminders going off, I don't remember why the first one went off.
I was just curious if you have the BioNess bits at your location.
We have it at our Huntsville clinic. We don't have it at our Decatur clinic. So
I was just curious about, I'm 2.5 hours away, and I just found out about this event when I went for my checkup and saw the flyers. I'm in northern Mississippi, and as far as I know, there's no MS support group anywhere in my vicinity. And I know of just where I live, there's about 10 of us that have MS. And I just didn't know if you had any suggestions or if there's somewhere I can go to, how to start a support group.
I'm full confessions. IT is not my strength. I have tried to do our support groups with a Zoom meeting option with limited success. I would definitely be willing to try that again if I could figure out. My snag is they can hear us, but we can't hear them. So Zoom meetings, and there are a lot of resources on the internet. Does anybody belong to any of the internet support groups? Yeah, you do. And how is that? Have you been to both in-person and internet support groups? Just online. And so that's an option if you're isolated. Also, the MS Society has resources as well. MS Views and News has resources.
So with regard to the support groups, you can go to the National MS Society's website, and it's 1-800-FIGHT-MS. Also, you can give them a call or go online and simply look up support groups. And they have a lot of them across the country, in person and virtually. All right, that could help you out. Also, the MS Foundation, called the Multiple Sclerosis Foundation. You can also look them up. They have scattered groups in rural America that might be of benefit for you. Where are you located? Where? Oh, that's somewhere nobody knows about. Right, yeah, okay. All right, we'll try to help you out, all right? Great. Anything else? Anybody got a question?
Okay, I got a question about, I'm doing sit and stand,
Yes.
and the machine that you have, can you tell me a little bit about it?
Yes. So one of the gadgets that we have in our clinic is called the Biodex Walker, and it's really cool because it's got a harness that you wear on your pelvis, and you push a button, and it can help to lift you up if you've got weakness with moving from sit to stand. And then once you're up, it's got a walker part so that you can walk forward. You can pick it up so that it's supporting part of your weight. Part of what makes walking hard for people with weakness is that you have to shift your weight onto one leg and then pick your leg up and move it forward. But if your body weight is supported, then it takes less effort to do that. And it's been very helpful to some of our patients in trying to develop their strength for walking. That device also is something that some of our patients have purchased for home use. It's affordable for people to use in their home. It was designed for people to use in their home, not in the clinic. Some of this stuff is, you can never use it in your house, so you just have to use it in the clinic. But this one you can use in your house.
How do I know if my cognitive abilities are more severe than normal?
So one of the things that can be really helpful is to get some baseline testing on your cognition. Now in our area, typically, when people think about that, they think about being tested by a neuropsychologist. The problem is there are very few neuropsychologists around, and sometimes the wait time is crazy to get in with a neuropsychologist. So what works well for a lot of our patients is to get baseline testing with a speech therapist. Our speech therapists are able to do pretty sophisticated cognitive testing. It's more than just like the mini mental. The mini mentals gives you a rough idea if you have problems, but it really doesn't give you enough refinement to be able to tell, am I getting worse? Am I staying the same if you retest in the future? So that would be one of the things that I would highly recommend is if you think you've got cognitive problems, even if you think you can handle it well right now, it might be a good idea to get a baseline, and then that way you can tell in the future, is this getting worse, or am I, just paying attention to it more? I just never paid attention to it before. It's been like this all along, but now I'm just focused on it. So cognitive testing with a speech therapist can be really helpful.
Okay, on coordination, like when you're in the kitchen, okay, with memory issues, all right, I forgot how to organize. And then plus remember where I put it to put it back where it's supposed to go.
Yep. So that happens to a lot of people, actually. It happens to me. I reorganize my kitchen and I think, oh, darn, I remember where it used to be, and then I remember I reorganized it, and now I can't remember where I put it. But then if you have memory and cognition problems on top of that, that's like 100 times worse. And so, again, occupational therapists are really good at helping you organize, make strategies for how to organize, help you declutter. Maybe you don't, like, for example, I got rid of my cheesecake pan because I decided my days of making cheesecake are over. I just go to the store and buy cheesecake now. And so I don't need this pan cluttering up space in my kitchen. So occupational therapists can help you with strategies like that, help you figure out, is there stuff you need to get rid of so you don't have so much stuff? Where to put it so that you're putting the things you use frequently at a level that's easy to access, and the things you don't use often in a level that's not, that you're not having to bend down or reach over your head all the time to use the things that you need to. And then simplifying cooking, like meal planning and strategies for remembering, using timers, using checklists to remember, what steps did I do? Do I need to get this out of the oven? And strategies like that.
Okay, let's thank Karen for coming here today and speaking with you all. All right, so we're wrapping this up. Again, thank you everybody for coming. We cannot do these programs without you. And so thank you. Thank you.